I'm Russ Jaffe. I'm an internist and biochemist, a certified clinical nutritionist, and a fellow of the National Academy for Clinical Biochemistry. I maintain an overseas status as a fellow of the Royal Society of Medicine. I'm a fellow of the American Society for Clinical Pathology, the American College of Nutrition, the American College of Allergy, Asthma, and Immunology, and a fellow status in the American Medical Laboratory Immunologist. I'm a fellow of the Health Studies Collegium Research Foundation and director and founder of both PERC and ELISA ACT Biotechnologies. Well, to review our message from the last webinar, bone has some primary cells that have very important functions. And if we start this time in the upper left, we see the important functions of these bone activities are mechanical support, sites of muscle insertion, reserves of calcium, magnesium, and other alkalinizing minerals for the body. And as I pointed out in the previous webinar, bone is also piezoelectric, and when we move, these tiny electrical stimuli help the osteoblasts to know where to put the new bone and help the osteoclasts know where to resorb the bone that needs to be recycled. The most important cells from the bone perspective are osteoblasts, the bone-forming cells, osteocytes, the mature bone maintenance cells, and osteoclasts, the cells that break down and resorb the bone that's worn out and in need of renewal. Also a review from the last webinar, there are three big issues in regard to bone health. The big three are vitamin D, calcium, and parathyroid hormone, or PTH. Vitamin D3 comes in as cholecalciferol. The liver hydroxylates it in the 25 position, leading to 25-hydroxy-D3. The kidney then adds the 1-hydroxylation to make 1,25-dihydroxy-D3, the active native form that, among other things, causes the intestines to increase calcium uptake, raising the blood calcium level and increasing available calcium for calcification processes in the bone or anywhere in the body that calcification is favored. Subject for another webinar on cardiovascular health at another time. You're welcome to review the previous webinar by going to our website, www.perque.com/podcast, to see not only part 1 of bone health, but the entire repertoire of archived webinars. The next webinar is Bone Building the WellGuard Program. We will look at the PERC nutrient program to bring repair and decrease inflammation, which is really repair deficit. We will learn how to apply the Physiology First approach to restore homeostasis and support the Alkaline Way, and we'll look at case successes. Well, the Alkaline Way does have certain clinical or pragmatic goals. The first is a positive mineral balance to restore, to repair, and to defend the body. The second is to remind us that inflammation is really repair deficit, and repair deficits are the cause of osteoporosis and many other problems in the body. So managing what we think of as inflammation but is really repair deficit is very important to bone health. Physiology First to restore host homeostasis via predictive tests that are applied functionally and individually, referencing healthy values. This is what I hear the best and brightest of policy people and of active consumers and of thought leaders in biomedicine calling for predictive tests, sensitive, specific, predictive tests that are more functional, that are individually applicable, and that reference against healthy values. We've had the privilege of contributing to that conversation in the following way. The Alkaline Way overriding markers of health and health risk, of health and vitality, of health and ill health risk. There are 5 of them, and they are first, the acid-alkaline metabolic status, measured by first morning urine pH, to be kept in the 6.5 to 7.5 healthy value range. The second is rethinking inflammation as repair deficit and measuring HSCRP, high sensitivity C-reactive protein, to bring it to less than 0.5. Detoxification and methylation, and marked by the homocysteine levels. We want to bring enhanced methylation to bring down homocysteine to less than 6 milligrams per deciliter. We want oxidation and antioxidant status to be measured by oxidized HDL and LDL and 8-oxoguanine and have these undetectable. We want stress hormone balance, measuring free cortisol and free DHEA in saliva or in plasma. And taken together, these are the alkaline way to maintain positive mineral balance for bone health, to restore, to repair, and to defend the body systemically. So better bones, better bodies. As Susan Brown has aptly titled her book, that has now been in several different editions, and I call attention to her leadership, both as a medical anthropologist and as a specialist in bone health, for articulating and guiding people in this alkaline way. Now, the acid-alkaline metabolic state is linked to osteoporosis because net acid excretion is implicated in bone loss. There's an increase in calcium loss with a high NAE, or a high net acid excretion. That's driven by dietary protein. More than 60 grams a day contributes keto acids. Fruits and vegetables are the antidote, if you will. Fruits and vegetables, lentils, pulses, beans, and sprouts and nuts and seeds and herbs. All are mineral rich, alkaline forming, and they counteract the mineral deficits. pH strips correlate with overnight equilibration, or allow for overnight equilibration of the urine with the cells, so that there's a reasonably good correlation between net acid excretion and first morning urine pH measurements. We favor the ease of the first morning urine pH, and we want the healthy range 6.5 to 7.5. Acid is harmful, and net acid excess upsets the working of cell machinery. It decreases energy production in the cells from loss of the proton gradient, and it increases loss of critical minerals from the body through the urine, but also through the stool and through the sweat. An acid-forming diet is all too common. It's the standard American diet. You see some of the representatives here that contribute to it. And we recommend a better way. An alkaline-forming diet. The alkaline way benefit neutralizes excess metabolic acids to sustain health and vitality, preserves bone, enhances bone reformation, restores digestive and immune system competence, and helps regain tolerance to immune reactivities. So resetting the immune system to tolerance, neuroimmunohormonal balance, healthy bone, healthy digestion, these are the benefits that directly come from living the alkaline way. Here you see a table, food and chemical effects on acid-alkaline body chemical balance, something we had the privilege of putting together, that identifies the alkaline-forming foods and the degree of alkalinity. These are the ones on the 4 columns to the left of the midline, and to the right of the midline, 4 columns of progressively more acid-forming foods. For repair, we recommend that 80% or 8 parts of what you put on your plate should be from the left or the alkaline-forming side, and 20% from the acid-forming side is fine. And when you're healthy, for maintenance, 60%. Slight dominance of alkaline foods when you're healthy, a predominance of alkaline foods, but not exclusively alkaline foods, when you're repairing. The alkaline diet would probably have a minimum of Frito-Lay type of products, of Pepsi type of products, but would have lots of fruits and vegetables, lots of sprouts and seeds, lots of legumes and pulses, lots of fresh greens, eaten at the peak of their freshness and their color, lots of fiber, lots of chewy foods. These would be the alkaline diet. Susan Brown and I did write an article, Acid-Alkaline Balance and Its Effects on Bone Health, in the International Journal of Integrative Medicine in the year 2000. It calls attention to the use of these pH strips that you see in the upper right, and that the acid-alkaline balance is essential to bone health, with the healthy zone being 6.5 to 7.5, not too low, not too high. Below 6.5 suggests net acid excess, and above 7.5 suggests catabolic illness, and auto-cannibalization where lean muscle is cannibalized for energy. And we want to reset away from catabolic illness and away from metabolic acidosis into the healthy, narrow zone of 6.5 to 7.5 for the urine pH first in the morning. Now, in regard to PERK bone health nutrients and the PERK WellGuard program for bone health, It includes Perk Bone Guard Forte 20, Perk D3 Cell Guard, Perk Mag Plus Guard and Perk Choline Citrate, Perk Potency Guard, Perk Joint Guard, Perk EPA DHA Guard. Each separately enhances bone health and together virtually assures healthy bone for a lifetime. Better bones are the Alkaline Way. The Alkaline Way includes 20 bone builders. Perk Bone Guard Forte 20 includes all 20. The lack of any one of the 20 that is rate limiting will limit the repair of the bone. This is von Liebig's law from 1828. We updated it some decades ago, pointing out that a complex cell system is constrained or limited by whatever is least available among the essential nutrients. So since there are 20 essential nutrients in the bone for every living human being, whichever one is least will influence the bone vitality, bone recycling, bone health. Fortunately, Perk Bone Guard Forte 20 contains 100% bioavailable and alkalinizing minerals, a number of them, and we have done confirming outcome studies documenting improvements in bone density by DEXA score after 2 years on a consistent basis. Here you see Perk Bone Guard Forte 20. The 20 bone builders include 13 alkalinizing minerals: calcium, magnesium, boron, strontium, zinc, copper, silica, manganese, selenium as selenomethionine, iodine, and iodide. 5 bone supportive vitamins: vitamin D3, vitamin K1, vitamin K2, buffered ascorbate, also known as vitamin C, and biotin, part of the B complex family. We also include germanium as the sesquioxide for osteoblastic activity and action balance, and polyphenolics and fiber, which are also essential for healthy bone dendritic cell activity. So a total of 20 bone builders in the comprehensive Perk Bone Guard Forte 20 formula. Here you see what you would also find on our product information literature, the degree of bone building in a group of people following the Alkaline Way, including Perk Bone Guard Forte 20. You see 5%, as little as 2% new bone, as much as 9 or 11% new bone in this cohort, but consistent bone building. And we have, since about 1990, guaranteed that folks will build new bone following the Alkaline Way, checking first morning urine pH, including taking their Perk supplements. And we will refund to anyone who does not build new bone what they pay for those supplements if it doesn't deliver the healthy bone that it should. And we do not get requests for that. In fact, we get compliments that, to their doctor's amazement, they have built new bone for the first time in their lives. So Perk Bone Guard Forte 20 is comprehensive. It has all 20 bone builders. It has a 100% money-back guarantee if the DEXA score is not improved 2 years on in following the approach. That includes Perk Bone Guard Forte 20 and the Alkaline Way. In terms of how much to take, we recommend for osteoporosis 6 to 8 capsules a day, for osteopenia or risk of osteoporosis 4 to 6 capsules a day, and for maintenance for healthy people who want to maintain healthy bones for life, 2 to 4 capsules per day. Vitamin D3 is very important, and it's even more helpful when it gets into the body. Recommended healthy intake for children are 400 to 1,000 IU a day, adults 2,000 to 5,000 IU a day. Vitamin D3, the cholecalciferol, sufficiency, if you have enough of the vitamin D3, as measured by the 25-hydroxy-D3, not the 125, but the 25-hydroxy-D is the functional measure of blood or plasma vitamin D activity. And the 25-hydroxy-D should be 50 to 80 nanograms per ml. And for example, more than half of Americans are deficient in vitamin D3. They have blood levels of less than 25. And by comparison, if you have a blood level of less than 25, you have at least twice the all-cause morbidity mortality risk that you would have if you had a blood vitamin D3 25-hydroxy-D level of 50 to 80 nanograms per ml. And now perhaps the most important piece from the PERC Physiology First perspective. According to Dr. Mike Hollick, who's also known as Dr. Sunshine because of his work on vitamin D, according to Dr. Mike Hollick, 40 million or more Americans do not absorb vitamin D from their intestines. So for them, the vitamin D must come in through their mouth. And that's why the vitamin D from PERC D3 Cell Guard is a drop, 500 units per drop, and we recommend 1 or more drops per day based on professional guidance and in order to keep the healthy vitamin D level in the 50 to 80 nanogram per ml range. Now, vitamin D3 for bone and body health. Low D3 levels, less than 20 nanograms per ml, are associated with osteoporosis and osteopenia, but also increased pain in the bones, osteomalacia, soft bones, muscle weakness, and an increase in minor trauma leading to fractures. So low vitamin D levels are associated with a whole bunch of problems that are correctable by having a healthier vitamin D level. The physiology of vitamin D, to review briefly, the cholecalciferol comes in from the intestines from the outside. It goes through the liver, which converts it to 25-hydroxy-D3, the pre-hormone, and then to the kidneys, which convert it to 1,25-dihydroxy-vitamin D, the active metabolite that builds the bone, helps build the bone. PERC D3 Cell Guard for bone health and bone building to increase intestinal absorption of calcium and phosphorus that leads to providing osteoblasts with new bone building blocks. But the special micellized droplet form of liquid under the tongue is consistently and easily taken up, not having to worry whether you're part of the 40 million or more Americans that don't absorb vitamin D from their gut, according to some research. PERC Joint Guard works well with PERC Bone Guard. For better joints to be rebuilt, you need cartilage, you need collagen, the type 2 collagen particularly for the joints, and you need glycosaminoglycans, the water-binding shock absorber molecules. And PERC BioPair, PERC Joint Guard, is a unique formula patented by us to enhance joint formation, to activate dendritic cells, and to decrease inflammation in and around the joints as they're rebuilt. Magnesium is a very important buffering mineral, the second most common mineral inside the cell, along with potassium. Magnesium is the most alkalinizing cell mineral because of its double positive charge. Ionized magnesium and choline citrate together overcome magnesium uptake block by forming a neutral tiny droplet in the gut that's taken up by neutral cell pores. So we discovered and patented that when you combine ionized magnesium and choline citrate, you form a tiny nano droplet, a tiny neutrally charged droplet that's taken up from the gut by neutral pores. And here you see an example of 4 people who were studied for 3 months. During the first 4 weeks, they took magnesium only, and you see their ionized magnesium levels were consistent but low. Then they took the PERC Mag Plus Guard and PERC choline citrate together. Their ionized magnesium came up over the next 4 weeks and substantially and into the healthy range. And then for the next 4 weeks, they were maintained just and observed, and 3 of the 4 started to lose significant amounts of magnesium. 1 seemed to be retaining it reasonably well. And so this suggests the benefit and continuing benefit and continuing need for PERC Mag Plus Guard and PERC choline citrate. The marker here is to keep a healthy first morning urine pH and to have that measurement be in the 6.5 to 7.5 range. And this is one of the important discoveries that we have that allows us to help alkalinize and support healthy bone regrowth. PERC Potency Guard provides the mother antioxidant for all other antioxidant protection. We recommend PERC Potency Guard based on individual calibration. This is buffered, 100% reduced, 100% L-ascorbate as the mother antioxidant for the body. We offer it with magnesium, potassium, zinc, and calcium balanced minerals. There are no hidden ingredients. It's a full disclosure label. It's safer for people with food and chemical sensitivities because it's triple recrystallized. It is also synthesized under a nitrogen blanket so that it's fully reduced and with the minerals fully buffered. This superior PIH Potency Guard allows us to find out how much ascorbate individuals need, and that's what you see represented here. Reports from 3,496 people. The bright yellow are people who calibrated on less than 4 grams, and they were generally asymptomatic. People who calibrated between 5 and 10 grams in the dark blue, and they had minimal symptoms by Cornell Medical Index. Typical ambulatory people calibrated between 10 and 130 grams. This was the 80% of the population that have symptoms but are ambulatory. And about 1 in 20, or 5% of people, calibrated above 130 grams, indicating significant oxidative stress and free radical risk that the ascorbates were dealing with and doing their best to manage. Changing people's oil is a very important part of healthy American living today. Omega-3 and bone health, we think, go together in a very important way. PIH EPA DHA Guard is the richest omega-3 source available. You get from 2 soft gels 660 milligrams of EPA and 500 milligrams of DHA. That's per dose, which is 2 soft gels. And this is to restore PGF2 alpha and PGI for repair that prevent bone loss. There are helpful prostaglandins and unhelpful prostaglandins, or prostaglandins associated more with repair and others associated more with lack of repair. This helps maintain oxidized HDL and LDL at 0, helps prevent 8-oxoguanine from forming. And as I mentioned, and these also are distilled under nitrogen, and nitrogen purged throughout the process so that the EPA DHA essential fats are not oxidized in the course of their manufacture. This is to assure purity and to protect the polyunsaturated fatty acids, the omega-3 PUFA EPA DHA. Dosage would be 2 to 4 soft gels a day based on professional guidance, and each pair of soft gels contains 660 milligrams of EPA and 500 milligrams of DHA. Now, the Alkaline Way has certain basics that I would like to review with you. The first is to calibrate your ascorbate so you have enough antioxidants to meet your needs. Calibrate or determine individually how much ascorbate or vitamin C the individual needs to deal with their oxidative risk and free radical activity. You're welcome to check our website for these tools and these individual protocols. On the bottom of the slide, you see the access to that tools section. In addition to calibrating or individually determining how much ascorbate antioxidant intake is needed, the second is to stay well hydrated. Here you use the wrist skin pinch relaxation test, and if the skin on pinching doesn't go flat within 1/1000 or within a second, you take a glass of 8 ounces of water and measure in about 20 minutes after it's been assimilated, and you'll see the improvement. You want to stay well hydrated to wash the kidneys and to maintain physiologic hydration health. The third component of the Alkaline Way is to have enough magnesium and other minerals to keep the first AM urine in the healthier 6.5 to 7.5 pH range. That's principally done through an alkaline diet and then supplemented if needed, particularly with PIH Mag Plus Guard and PIH choline citrate to enhance the magnesium uptake and to provide healthful magnesium, along with the magnesium, to provide helpful choline and helpful citrate. The fourth component of the Alkaline Way is to have enough prebiotic fiber and probiotic bacteria. The prebiotic fiber, 40 grams or more a day, probiotics, 40 billion healthy bugs, either from fermented foods or from supplements, sufficient to replenish intestinal health and have a healthy transit time, which is 12 to 18 hours. And again, this transit time test, along with the first morning urine pH assessment, along with the hydration wrist skin pinch relaxation test, along with the ascorbate calibration, are all available on our website as individual assessment tools. The Alkaline Way has a few more components, which include eating in harmony with our nature and lifestyle. The Alkaline Way eating as much that's locally grown, including in our own kitchen gardens, vine-ripened, organic, or biodynamically derived as possible, making restorative sleep a priority so that our adrenal stress index is as low as possible. This might include a salt and soda bath and abdominal breathing and the use of the dichromatic green light as part of our relaxation pre-sleep preparation. The seventh is to work muscles and relax in some proportion. We want to be physically active, we want to be mentally active, we also want to physically relax and mentally relax in some balance based on our nature. And the last is to do our best and to appreciate ourselves for doing our best, knowing that we're not perfect, but that we are, with each choice, doing a little better, and that, taken together, are the 8 principles of the Alkaline Way. Intimately related is the innate immune system, which is responsible to protect, to recycle, to defend, and repair us. There are an interdependent set of health habits, including balancing out rest and breathing, along with activity, mindfulness, particularly active meditation practice, weight-bearing exercise, walking, rebounder, trampoline, or similar, active stretching, Traeger mentastics, Pilates mat work, Feldenkrais technique, Alexander technique, and then, as needed, alkalinizing salt and soda baths, along with abdominal breathing, along with dichromatic green light. And bringing all this together, checking first morning urine pH after rest to keep it in a healthy 6.5 to 7.5 range. Below 6.5 suggests excess acid and mineral deficits that impair physiology, and above 7.5 suggests catabolic illness, where the body is cannibalizing lean muscle for energy and wearing itself out. Now here's a case report contributed by our colleague Susan Brown, 64-year-old white woman, 14 years postmenopausal at the initial visit, estimated calcium intake of 1,500 milligrams a day. She'd had a full hysterectomy at age 44, put on estrogen replacement therapy, ERT. She stopped ERT at age 61, which was 3 years before. She had a tendency towards irritable bowel with constipation. Lab parameters showed her vitamin D to be 32 nanograms per ml, and while that's sufficient from the lab's point of view, I believe that's less than 50, so from my point of view, that is low. Her baseline urine NTX was 33 nanomoles per millimole, with normal premenopausal range. Baseline bone mineral density showed spine 0.767, total hip 0.633, radius and ulna 0.375, and as you can see, those are in the relative osteopenia to osteoporosis range. Medication including Inderal and beta blockers for blood pressure. Her integrative interventions included Perk Lifeguard, Perk Bone Guard Forte 20, Perk Triple EFA, Perk Vitamin D3 Cell Guard, and the Alkaline Way with exercise. And after just a year and a half, now this wasn't a full 2 years, but after just a year and a half, 1.7% improvement in the spine bone density, 6.2% in the total hip, 4.4% in the radius and ulna. She's a very happy camper.